Timeless 106.1 KFFB. Thanks so much for joining us for another edition of our open mic program. And we have David Deaton with us. He's administrator of the Ozark Health Medical Center in Clinton. And David, thanks so much for taking time and talking with us here in open mic.
You're welcome.
Well, you know, something we got to talk about. There's a couple things. One, if we want to talk about a CNA program that I think is out of the park. And that is what a lot of people think about. What is a CNA? And when you're looking at the nurses in the pandemic, in the flu season, when there's a lot of illnesses and things go through, they're really worked hard, but you have CNAs. Explain what a CNA, how it assists in a hospital.
Right. Well, a CNA is a certified position. It's an aide, and CNAs work in all kinds of settings, but primarily people know them for being the people that take care of nursing home residents. That's the primary area that we use CNAs, and that's probably the largest job category of CNAs.
So nursing home, and they also do in the hospital too. Some.
Yes, in the hospital as well as home care, and we have them in all areas of Ozark Health.
Now, what's really unique that I heard that when you're doing the fundraiser for the foundation, you guys are talking about that you started a program for CNAs that you pay them immediately when they start to work for you, and they're going to school and they get paid just like they're going to be working, and that's really a unique position for someone that wants to kind of put their feet into the healthcare position.
Absolutely. Over the years, we've supported CNA education. We hire CNAs that are already certified, but we train a lot of CNAs, and it's to some folks it's an entry level position, and so you'll have a lot of younger people or people that are not in the healthcare profession. They want to get into healthcare, and maybe they don't want to go to RN school, for example, but they want to provide service to folks. So they'll go to CNA class, and we've funded a lot of that over the years. However, something that we've done recently that you just referred to, many times people cannot quit their current job to go and take a CNA course, which is several weeks, to become trained and all that. So we identify that as a roadblock to people. So we made a decision not long ago to begin to pay people while they took the class. For example, if somebody had a job and they wanted to go CNA school, they could come to work for us, go to school, but technically you would begin to be paid while you're in school. And it's not a lot of money. Initially, it's minimum wage. But once you're certified, of course, that goes up. And we just felt like that was a way to eliminate that roadblock to people who wanted to go into that profession.
When you're going in an entry-level profession, this can move to nurses. Many nurses were CNAs first, and this is just so they can experience what the hospital is like. It's almost like a shadowing, really, isn't it?
It's an opportunity to get to see firsthand what goes on in a healthcare environment. And I'll tell you, our director of nursing at Ozark Health Medical Center, a well-trained, highly educated, registered nurse, years ago, she was a CNA. And so many of our nurse leaders today were CNAs, and as well as many of our other nurses that work at Ozark Health, and not just here, but everywhere.
So how does a person, no matter what your age, you got to be over 18, so it doesn't matter your age. If you want to kind of do this, and there's some people looking for something to change, how do they get a hold of you guys?
Well, you can call us at 501-745-7000. That's their main number at Ozark Health. Contact us. Tell them you want to talk to someone about the CNA class, and they'll put you in touch with who that is. We're trying to gather students to have a class now. We try to have a minimum number, so when the instructor has a class, it's a large enough class, but I can tell you our classes are not extraordinarily large. We try to make sure that the students get good attention paid to them, and they get an opportunity. And then again, they get to train not just in the nursing center, but they train in the hospital some as well. So
it is an awesome opportunity.
Right.
All right, the other thing that everybody's been talking about, and this seems like it was dominant on news until Afghanistan came along, and that is the COVID variant has exploded. The vaccines, the governor's been in Batesville, in our listening area, Heber and Clinton, and that's something that was talked about. And one thing that I noticed when the governor was speaking in Clinton, I was standing in the back of the room just kind of watching people, and you got the vaccination folks, you got the non-vaccination folks, and then you got the people in the middle that don't know what to do, and they try to get more information, and sometimes it's so controversial when the governor had to back up and says, I'm sorry that I said that there is no side effects with the shot, and a nurse kind of called him on it, and it was probably not meaning to, it's just saying there's no adverse side effects. So you can't. So there is side effects. How would you? What is the side effects for COVID? I hear people talk about, but you never have them read it. What are some of the side effects that you can have?
It could be anything from a sore arm, which I experienced. I was vaccinated. I was among the first that were vaccinated in our area. Us non-clinical people. And I became vaccinated, and my side effect was I had an arm that was a little sore. I woke up early the next morning and a little achy, and got up, took a couple of Tylenol, and went back to bed. And 2 hours, 3 hours later, I felt great. And so during the day, it didn't bother me. At night, it bothered me a bit. And that's just because, you've had a needle stuck in your arm, and you've had something put in your body. We forget what a vaccine truly is. It's not a medication and antibiotic or that kind of thing. It's something that's designed to build up your immune system. And it triggers your body to build up the antibodies. So many people they'll take the vaccine, whether it's COVID or maybe even influenza vaccine or whatever. And their body, it's trying to gear up to fight an illness. And some people do have side effects, certain things. I would say I'm not aware of anyone that's had very serious side effects. I've had people that didn't feel good for a few days, And I've had people such as my wife who had zero side effects. I mean, nothing, If she didn't remember taking the vaccine, she wouldn't have been able to associate any, aches or pains or anything to that. And so what's being said, and I didn't see exactly what the governor said. I think probably a better statement is the majority of folks don't experience those side effects. And serious side effects are probably pretty rare. I don't think we should say there are no side effects to this. However, the folks I know that have taken the vaccine, I'm unaware of any serious side effects personally. And this is the way I look at it. The vaccine isn't a cure-all. It's not going to prevent everybody from getting COVID. It doesn't prevent everybody from getting the flu when we take our annual flu vaccine. I think what it does, it improves our chances. The numbers since February in Arkansas show that approximately 90% of the deaths or hospitalizations in Arkansas are unvaccinated folks. So that doesn't mean if you're vaccinated you won't go in the hospital. It doesn't mean that if you're vaccinated you won't get seriously ill and pass away from COVID. But when 90% of the serious cases are unvaccinated, that tells me that there's some effect on improving your risk factor for either being seriously ill or even passing away from COVID. So, if we've had a vaccinated person in our hospital that was that severely ill, it may have been one. I don't recall, but normally I ask, are these folks vaccinated or not? And it doesn't matter to me, and we're going to take care of them, but I'm curious, and I'm just hearing that generally, no, they're not vaccinated. So I just want to encourage people to consider it. I don't want to try to shame anybody into taking it, which sometimes I think people feel that way. But I do want people to really consider that it improves your chances, and that's what I believe. And
sometimes I think they oversold it, though. When we talked about the vaccine, they says, throw your mask away forever. You won't ever have to mask if you get the vaccine, and then a mask got to come back. And the other thing, I understand why people have that concern, because another thing is it's 6 months. They're saying now 6 months it's dropping. Yeah. Well, the vaccine's really for January or so we're not even at the 6 months point. And that's where some of the arguments saying, hey, what you're seeing is people non-vaccinated, but those vaccinated may be getting there if they don't get a booster shot. Numbers can change. But the only thing I can look back at is March of 7th, 2018, one of the papers said there was 5 weeks left of the flu season. Usually takes 20 weeks. There was 184 Arkansans in 2018 that died from the flu. So that's real numbers. That's something that this is a lot more serious. 5 times effective, maybe 6 times more than the flu is what they're saying, correct? Right. So it's a lot more. And they said out of that 114, they had data whether they're vaccinated or not. And so of those deaths, of the 114, 38 had been vaccinated, 60 had not, 33 to 66 really. But that's something that I guess that's why people kind of slow down and hold back, and they and the antibodies. Another thing we don't hear about, those that's had the flu or the flu, you got antibodies. Those that had COVID have antibodies, and we don't know how long that lasts either. You hear some lifetime, some it says 6 months, some says it's 90 days. You don't see numbers on that because it's so new, right?
Well, the first vaccine was available to us the last 10 days of December. And so now, what is it, 8 months since I've had my last dose? And so I don't know what my antibody count would be if I took it. I know there's people that have talked about it, but no one can say what it is long term because it's not, even in the trials aren't probably any more than a year old at the very oldest. So we really don't know. all I know is I look at the numbers bear out that if you take the vaccine, it seems to improve your chance.
That's why I always say, sometimes I think they came out, and that's where you hear it both. We all have friends on both sides of that, but where they came out and they overpromised and underdelivered because the mask is getting the mask back. But now you see it is like, okay, let's just tell the real, and that's what I'm having, an honest discussion. I mean, I'm not telling anybody what to do. Talk to a professional, and that's why I appreciate you kind of talking about it. It's something we need to really talk to their professional physician.
Doctors, nurse practitioner, whoever you see for your routine health care, talk to them, and most of them will be pretty straight with you about it. And some, I've heard varying opinions on the vaccine, for example, from different healthcare providers. So everybody has an opinion on it. Talk to your doctor or your nurse practitioner about that, and then you make the decision. And I think most people, if they think about it, if they have any kind of risk factors, I think that plays a role in your decision. And I have an uncle in his mid-80s. Last month, was in the hospital in the ICU on a ventilator with COVID. And, of course, I was naturally concerned about that. And a few days later, he come off the vent, and I didn't hear anything for a while and found out he went home. And so he's vaccinated. Do I think that played a role in it? There's a very good chance it did. Nobody knows for sure. I believe the numbers bear out. This thing about following the science, that term is tossed around. I don't look at the science. I look at the number, and that's how I make decisions, and science has a lot to say about things. But I think people just should make the decision based on what they think's best for them. Look at the numbers. And the thing about the mask, if you take the vaccine, you don't have to wear the mask. Well, then they changed their mind on that. And I think the message, I'm not trying to be critical. I think the message, though, should just be very simple. And if you say take the vaccine, you don't have to wear the mask, I think that's the way it ought to be. And I think that's why a lot of people are hesitant. They hear different messages. And so I try not to give an opinion of mine unless you ask me for it, Otherwise, it's just here's what the numbers are.
That's exactly right. It kind of goes back to when this pandemic hit, on the very 1st of March. I remember Senator Bozeman was getting more information. We didn't have that much information. Remember, we were all sitting around the radio, and when we heard the governor or the president at that time and talking about it. But one thing that he says, well, Bob, one thing we can do is like we do in the flu season. His mom always says, wash your hands and keep your hands out of your mouth. And those are some things to do. Wear your mask and social distance. And, that's pretty much we should stay on that. That's why the flu was gone last year, is because I really think that we were doing those things without the vaccine. And so either way, whether you're vaccinated or not, let's, keep up that pace of washing our hands and using hand sanitizer. And I think that just keeps the germs down.
I think hygiene is the biggest thing you can do to prevent infection, including COVID or flu. I think the second thing you can do, though, really is consider being vaccinated. I do strongly believe that. If you're sick, don't be around anybody. Wash your hands after you've touched things. Don't hug and kiss on people that are sick. That kind of thing. And you do those basic things. I think a lot of transmission is like within households and things. So close proximity does make a difference. Whether 6 feet is the number or 20 feet's the number or 3 feet's the number of social distance, I don't know. I just think that if people use their sense, which they have, they'll avoid it for the most part.
Well, David, thanks for stopping by, and congratulations on a new program that I think is kind of changed, and that's a CNA program where people get paid to go to school and see what it's like to be a healthcare professional.
Thank you, Bob, for having me.